First of all, let me make it very clear that those of us who advocate basic income do so fundamentally from a philosophical point of view. We believe that a basic income, and I don't use the term universal because of all the problems we have with saying who would be entitled to it, with migrants and welfare tourism thinking that has been used, bandied around. So I could prefer to use the term basic income. We believe in a basic income because it's a matter of common justice. That's fundamentally important. It's a matter of justice. The commons belong to all of us, and we have been deprived of the commons, and everybody should be compensated, and that sort of line. And you can take a religious justice point of view, as Pope Francis has done in justifying basic income, and the various arguments on justice. The second philosophical thinking is that it's a matter of giving everybody basic security, and basic security is a human right. So that's fundamental. And third, it's a matter of enhancing freedom. Every politician claims that they believe in freedom, but you can't be free if you're chronically insecure. And that's what vast majority of people are these days. So those philosophical arguments in the background. So in what I'm saying is that the evidence we glean from pilots and experiments are about really the low-hanging fruit. They are about the hypotheses of what sort of impact on behavior and attitudes a basic income has, and what is needed to help make it relatively successful if it were introduced. That's the first point I want to make. The second point I want to make is that we are dealing with a context in Wales, in Britain in particular, where we've moved into an era of chronic insecurity, of chronic uncertainty. It's unlike the Beveridge period. We don't know who is vulnerable. We're all vulnerable, and we lack resilience. And the word precarity is used. I've written a book called The Precariat, and it's very important to realize that the word precarious stems from the Latin to mean to obtain by prayer. And this is relevant for the pilot because basically precarity is about being a supplicant. And the fact that you have to rely on discretionary favors, be it from landlords, bureaucrats in the DWP, or employers, or your network of friends and families. That is what people write to me about, that they not only feel insecure, but they feel like they're precarious in that supplicant sense. And a basic income addresses that sense of precarity. Precarity is not just about insecurity. It's about being a supplicant. The next point I want to make is that we learn from pilots and experiments, even if, as 99% of the pilots I've seen, they are not full basic income pilots. I'm an advisor, and I've been for the past year for the Welsh pilot. We're calling it a pilot, but really it isn't a proper pilot, nor are most of the others, nor was the great Finland one that I was involved in advising on the design of that. I said, this is not a proper pilot. You're only concentrating on 2,000 unemployed, randomly selected across the country. That's not a basic income pilot. Same here, we're choosing care leavers from across Wales. The sample is gradually being built up. It's not a proper pilot. It's an experiment. But we're using the language of pilot to help legitimize, and I accept that that's okay with, as long as those of us involved in it realize that we are not actually testing a proper basic income, because a proper basic income is when every individual in every community is paid the basic income, individually, without being conditional in any sense. And there are community effects that you cannot possibly examine when we're just doing a random selection, whether it's care leavers or individual unemployed or any other group across a large community. And that's why I'm being quite suspicious about randomized controlled trials. When we did our big project in Madhya Pradesh, we had 12,000 individuals, split roughly half and half between 9 communities where everybody got the basic income and 12 communities where nobody got the basic income. Had we done a randomized controlled trial where we selected one person who was happened to be living next door to another, very quickly that person next door would have been knocking on the door and saying, hey, I want some of your basic income. Or you could have expected something like that, right? And it's the keeping the idea of a community is important. The multiplier effects, as we've found when we've done community level, are very high. And Jane Lewis made a point earlier that I want to address, because she was absolutely right, but you can't test it in most types of pilot. We were able to test it in Namibia and in India. And it will, I think, help answer her question, that when you provide everybody in the community, it leads to community-wide effects. It leads to multiplier effects from more income is generated than the income you put in for the pilots. And it leads to cooperative developments, community committees set up to advise on how best to spend it and how people should behave, etc., etc. So the dynamics of that are important to recognize. Now, this pilot experiment with the care levers, there are several points I would like to reiterate. I've reiterated it with colleagues working on the pilot. I'm slightly worried about the timetable. We've now already been working on it or around it for over a year. And the prospect of 36 months of payment, and then the prospect of a year to 2 years of analysis and all the statistical work, etc., the cleaning of the data, which takes a long time. I've done it in many things. It usually takes up much more time than people think, means that we're talking about a 5-year project, And that makes me worried on a number of scores. It's the same that I worry about the Give Directly project in Kenya. A 12-year project has incredible demands on people who are doing it. Fatigue, promotions, loss of interest, all that sort of thing behind the scenes actually dilute the effectiveness of the whole exercise. And a point that Kate made, and I'm delighted that she's going to be involved in the evaluation or what we want to call it, is that you need to be thinking that this is a process of legitimation we're engaged in. I very much hope that there will be a Welsh basic income in the proper sense introduced before this project is ended. And I think John made that what we're trying to do is legitimize the very concept of a basic income. And in that regard, we've had tremendous publicity already. I saw a piece written by the Welsh Conservative spokesperson on social policy, totally ignorant, said that the Finnish basic income pilot was so bad that it was abandoned as a total failure. That's a complete lie. It's completely untrue. And one of the things that people involved in this project are going to have to do over the next few months, in particular before the next general election, is be ready to get rid of misleading, mischievous statements. Have a policy of coming out and being able to address, no, that is not correct, yet no, that is not correct, because that will be taking place, I think, increasingly in the political domain. And that leads me to another crucial point, which I've made before. It's vital that the recipients of the basic income are anonymous. There should be no pre-media coverage of individuals and people who are receiving it. It's vital for the scientific, or whatever you want to call it, credibility, that the people's privacy be retained. And the last point I want to make as far as the pilot is that the hypotheses by the new evaluation team, and I listened earlier, excellent general principles, the hypotheses must be made explicit with control variables, with looking at past research results and so on, very much in mind, so that the proper control variables and the data are gathered. And that leads my last point, which is to just summarize what we and others, including Give Directly and the various pilots, there have been now over 100 altogether that are either in progress or have been completed. These are the main sort of findings that have come up. First, with health. A basic income leads to a lower incidence of illness and to a greater and more effective use of medicines. If people have minor or other illnesses, when they have a basic income guaranteed, they're more likely to take the treatment to completion and take it properly. Put that in your hypotheses as a test. The Canadian pilot, famous Canadian pilot, found that people who had the basic income had a much lower incidence of having to go to hospitals or clinics. That's a very important part of helping to legitimize it because it has public health expense implications. Big thing that's been found in practically every pilot that I've seen or been involved in is it leads to less mental stress. And the big thing that Michael Marmot has been making repeatedly, less mental stress leads to less mental illness and less morbidity, lower rates of morbidity, lower suicidal tendencies, and greater life expectancy and healthy life expectancy. That series of thinking has to be there. Another aspect is school attendance. School attendance and school performance have been shown to be improved by young people. And that will go on with the 18 plus years, learning, going to night school or whatever it might be. That should be tested. Very importantly, and I want to say this with as much passion as I can, basic income pilots have always been shown to show an increase in work, not a decrease. It's very important, and I summarized that in the book you mentioned, that the results, if you look at work in a proper sense, different types of work and multiple sources of work. Why I'm critical of many of the American style studies is they just look at labor force participation. That's a single crude variable. What we've tried to do is look at primary activities, secondary activities, third activities, the multiple forms. And what we found is that people diversify their types of work and increase the total. But if you only look at their main work, they might actually decrease their labor, but they increase their forms of work otherwise. The big issue in this project will be debt. We are now facing a pandemic of debt in Britain and many other countries as well. And this cost of living crisis, as we all know, is going to put people chronically into debt where they will drift into homelessness and suicidal tendencies. I hope that the test whether people will keep control of their debt will be tested in this project. And finally, and very, very importantly, what we found and others have found is that if you're paying an individual as an individual, they can move in and out of relationships in the way they want. One of the worst features of the pandemic, as we all know, is that abuse of women increased. And many women have stayed in abusive relationships because of their financial insecurities. What we have found is that the emancipatory effect of a basic income is greater than the monetary effect, and that women can move out of abusive relationships. I remember Republicans in the United States criticizing, saying, look, basic income leads to family breakups. If that's the way you wish to put it, I'm happy to say good, because if people can escape from abusive relationships, they can rebuild their lives. And that is such an important aspect of basic income. And we've found that in Africa, we found it in India, and we found it elsewhere too. It is really critical to include that set of issues in the evaluation techniques. So I've got many other comments, but I'll shut up at this point. I've thoroughly enjoyed listening to everybody, and I hope these few remarks are useful.